Doctor, I was recently told during a health checkup that my blood sugar levels are high, and I might have diabetes. I looked it up online and got so scared that I feel like I shouldn't eat anything, but then I end up stress eating a lot.
That does sound difficult. First off, diabetes is a condition where blood sugar levels are elevated. It happens when there's a shortage of insulin in the body or when it doesn't work properly, causing blood sugar levels to exceed the normal range.
Thank you. Your explanations are always so clear and easy to understand. I wish more people could hear your straightforward explanations about medical issues.
Thank you. Actually, we're running a YouTube channel to spread our information to more people. If you find this content useful, I recommend subscribing. That way, you can get the latest health information and advice.
That's great. I'll subscribe to your channel right now.
It can be worrying to hear you might have diabetes.
Yes, it is. I'm so glad you understand how I feel. Doctor, I've been incredibly thirsty lately. I keep drinking sports drinks and juices. Is that related to diabetes?
Thirst is one of the classic symptoms of diabetes. When there's a lot of sugar in the body, it tries to get rid of it through urine. As a result, you lose a lot of water, which makes you feel thirsty and leads to drinking more fluids.
Ah, so that's why I've been so thirsty. But is it okay to drink sports drinks and juices?
Actually, that's part of the problem. Sports drinks and juices contain a lot of sugar. When you're thirsty and reach for sweet drinks like these, it can create a vicious cycle where your blood sugar rises and makes you even thirstier. For managing diabetes, it's better to drink water or unsweetened tea, preferably without caffeine.
I see, maybe that's why my symptoms have been getting worse because I've been trying to quench my thirst with juices.
That's very possible. Too much sugar can exacerbate the symptoms of diabetes. Thirst is a sign from your body. It's important to choose the right drinks and seek early treatment.
I see, but I love juices and sodas. I can't seem to give them up.
Juices and sodas are delicious, but if you don't manage your diabetes, the risk of complications increases. These can include vision loss, kidney function decline, and peripheral nerve damage, among other issues.
Is it that serious? What exactly can happen if I don't manage my diabetes?
If left unmanaged, diabetes can lead to complications in various parts of the body. For the eyes, it can damage the blood vessels of the retina, increasing the risk of retinopathy, which can lead to vision loss or even blindness.
Blindness is a possibility?
Yes, in severe cases, it is a risk. Additionally, it can affect the kidneys, potentially leading to nephropathy, which is when the filtering function of the kidneys is compromised, and substances that should be excreted in the urine remain in the blood.
So it affects the kidneys too?
Yes, and it can also damage the nervous system, causing peripheral neuropathy, which can lead to numbness, pain, and abnormal sensations in the hands and feet.
That sounds serious. Are there other effects?
Yes, poor blood flow can also make it hard for wounds on the feet to heal, which in the worst case, can lead to gangrene. Plus, people with diabetes are at a higher risk for heart attacks and strokes.
It affects the whole body.
Exactly. Diabetes is one disease that can have various effects throughout the body. Early intervention and treatment can reduce the risk of these complications.
The complications of diabetes sound scary. I feel like I'd regret it for life if treatment is delayed. I'm getting anxious, doctor.
Now, stay calm. Early measures are necessary to prevent the worsening of diabetes. Especially, sugary drinks like juices need to be consumed with caution by people with diabetes.
But I'm not good at dieting or making an effort. And when I try to exercise, my knees start hurting right away.
It's okay. We don't expect sudden big changes. Just by gradually revising your lifestyle habits, you can certainly improve your diabetes.
Really? But it's going to be hard to give up juices completely.
You don't have to quit completely. How about starting by reducing the amount you drink and switching to water or tea?
I see, so I can make changes little by little.
And if you're worried about diabetes, I recommend going to the hospital for a blood test or to check the results of any recent health checkups.
Understood. But, doctor, to be honest, I'm really not comfortable with hospitals or doctors. Just thinking about talking to a doctor makes my heart race.
That's tough. It would be good if you could find a doctor you're comfortable with. Maybe getting to know the doctor through their website or YouTube before your visit could help put you at ease.
Right, that's a good idea. I'll start by visiting a hospital. Thank you, doctor. Please keep the advice coming.
Of course. And be sure to check out our other YouTube videos too.